kitchen management. It's a small topic. Today we will have very less participants because on occasion of Easter tomorrow, there are just very few participants. So we will do this small topic. So kitchen management, we'll just go through the guidelines that are required to set things properly in a kitchen. Kitchen is also a high risk area. Kitchen is also a high risk area. So dietary and kitchen services, what are the infection control measures you can take here? Okay. So daily inspections has to be done. As an infection control officer, one of a member in your team should be appointed at the kitchen services. Okay. Am I audible to all? Is my screen visible? So one member from the infection control team should be always put either on a rotational duty or should be appointed as an infection control officer for the kitchen services or dietary department. And you have to do the daily inspections here. Daily inspections has to be performed here because kitchens are identified as places that lead to outbreaks, especially of foodborne diseases. Okay, so on a daily basis, inspections are required. Okay, kitchen is a high risk area. The outbreak that happens in kitchen, it can spread to the entire patient. Okay, entire inpatient visitors, even outpatients can be affected who are eating from the canteen, kitchen, hospital canteen. Okay, outbreaks can happen from the kitchen as well if you're not hiring good staff. Okay, staff health and hygiene should be monitored on a regular basis. Look out for signs and symptoms of any communicable diseases in the staffs who work in the kitchen. Okay, and also their hygiene matters. Even if they're completely fine, okay, they look completely fine, they don't have any signs and symptoms, but if they have unhygienic practices, okay, we will discuss what are the unhygienic practices. There is a checklist at the end of this session. We'll discuss in detail. Okay, so staff health and hygiene should be monitored. Before you employ someone in the kitchen, pre-employment health checkup should be done. Why? To identify if any person is a carrier of any disease or not, like salmonella typhi. Okay, they may not have any signs and symptoms, but they can spread this disease to a large section of population. Okay, so check. You have to screen people, especially for being a carrier for any disease condition or not. Stool examination has to be done if they are having any hookworm infestation or any parasitic infestation is there in their body or not. Stool examination is done. Past history of the staffs in the kitchen should be taken properly. Food handlers with infectious disease must stop working and certify their fitness before they rejoin. Okay, whoever is handling the food, making food, or cutting vegetables, touching the food, preparing food, or even distributing food in hospital. Okay, if they have been diagnosed with an infectious disease, immediately they should take leave. They should get well. They have to bring their fitness certificate that they're no longer infectious. That fitness certificate is required before they rejoin the workforce. Routine medical checkup at least twice a year you should do. Okay, you have to make a sanction for the kitchen workers to get their medical checkup done within your own hospital. Okay, routine medical checkup has to be done at least twice a year. And document all the reports. Whatever medical checkup you have done on all these staffs, these reports should be documented. That will be used in auditing. Cleaning procedures should be done on regular basis. That is dry mopping, wet mopping the floor, kitchen platforms. Okay, cleaning the utensils, cleaning the knives, whatever is used. Okay, this should be done on a regular basis. Food storage area should also be clean and uncluttered. Wherever you're storing the food, it may be refrigerator or your pantry, should be clean and uncluttered. If you're going in to find something, you should get it in the right place. Everything in the kitchen should have a right place where it is kept. and it should be found at that place. Food capable of microbial growth should be stored below 8 degrees Celsius or above 65 degrees Celsius. Either it should be stored in a simmering hot temperature, simmering hot, not very boiling hot, simmering hot temperature, or it should be stored in a freezing temperature. Okay, because especially the food that is cooked, mostly all the food that has been cooked, it has to be stored below 8.8 degrees Celsius or 65 above 65 degrees Celsius. Cooked and chilled food should always be below 3 degrees Celsius in freezing point. Okay. Cleaning schedule should be followed on a regular basis without any delay or without skipping any of the scheduled timings. That's the housekeeping staff who have been appointed for cleaning the kitchen and dietary area. They have to look forward for this. Food should be prepared half an hour before service, stored in a bain-marie at 75 degrees Celsius to 100 degrees Celsius. Bain-marie, you must have seen, even if you go to a wedding service or anywhere, wherever buffet is stored, okay? Bain-marie is kind of a stainless steel long trolley-like setup, which has its own internal heating system. Okay, so whatever food that you have prepared and you are storing in that stainless steel containers, it will have its own thermoregulation that will keep the food hot for a longer period of time. Okay, that is the use of bain-marie, and it is a trolley kind of a setup. You can move it around different wards as well. And the temperature is always between 75 to 100 degrees Celsius. Okay, bain-marie can store the food while in motion. Okay, even when the catering services also use the bain-marie, the food is prepared somewhere else and it has to be delivered at some other point. Okay, it is delivered at a consumable temperature, hot temperature. They are using bain-marie technique. Trolley should be used for transport of food, should be cleaned regularly. Whichever trolley like bain-marie or any other trolleys, if you use to transport food, it should be cleaned regularly, and do not use this trolley for any other purpose. So drying ingredients, when you are storing it, it should be always cleaned before you store it. Okay, clean them out of if there is any bug, okay, any stones, any dirt or grim and dirt is there. Okay, it has to be cleaned first before storing it in plastic bins. Dry ingredients can be stored in plastic bins. Green leafy and other vegetables should be stored in refrigerator, washed before use. Okay, they have to be washed before used. Don't wash and store it in the refrigerator. It will wilt, it will degrade quickly. Okay, so green leafy vegetables along with the dust and soil, you can store it in the refrigerator. And before using it, or cutting it or chopping it, you have to wash them thoroughly, then use it for the culinary purposes. Milk should be purchased on a daily basis, and the purchased milk should be stored at 8 degrees Celsius in all seasons. Potatoes, onion, roots, anything that can sprout, okay? Anything that can lead to sprout. Like potatoes can also, if you keep potatoes in a dark environment, okay, they will start sprouting. Onions also, if you keep them in dark environment, they will start sprouting. Okay. So all roots and tubers, if you keep them in dark environment, usually they will start sprouting. So you have to keep them in well lit environment, but in plastic trays. Don't keep them in closed container because the humidity will lead them to sprout. Okay. Other vegetables should be brought at an interval of 3 days. Every 3 days, vegetable shopping can be done. Waste disposal. Even in kitchen, you can follow the same biomedical waste color-coded containers. Usually, you will be using green or black. Green and black is used in kitchen only if there is any cut or bruising. Okay, that food handlers or kitchen handlers on duty, if they get any knife cut, burns or something, and some immediate antiseptic is applied or wound cotton is applied, okay, that will go into yellow colored containers. A small yellow colored container can be kept, but otherwise green and black is usually used in kitchen. Any leftovers should be sent for disposal through municipal authorities, or you can compost it. At the hospital itself, you can create a compost, okay, compost service. So all the peels, fruits, vegetables that cannot be used or that have been that became a waste. Okay, food waste can be turned into compost, and you can use this compost in your hospital's kitchen garden itself. Now, this is a checklist. If anyone wants this checklist, you can WhatsApp me. I will put down my contact number in the chat box. So if you need this checklist, just WhatsApp me. By Monday, you will get the checklist. Because if I'm busy, I may not reply to you on time. So just WhatsApp me. I'll send you the checklist. This checklist can be used in your own hospital, kitchen, or dietary department as well. Okay, so personal. This is about the hygiene of your workers. These are the things about hygiene you have to keep an eye out for, whoever is working in the kitchen. Their clothes should be clean, neat, untorn, appropriate for work. Okay, shoes should be closed. Okay, not open-toed footwear. Closed heels, safety soles should be there, because in kitchen, oil can fall on the floor, water can fall on the floor. There could be slips and trips. Okay, so safety soles should be there. Socks should be worn. Hair net or hair cap are worn, and hair should be completely covered under the hairnet. Aprons are worn, and they are changed immediately whenever they get soiled. It should be changed immediately. So disposable aprons can be used. No jewelry except for watch, bedding band, okay, or earrings for women. Okay, apart from these jewelry, nothing else should be worn in the kitchen while working. All jewelries on hands should be removed when you are doing your hand washing procedure, or whenever you're contacting the food. All the jewelry should be removed. Good personal hygiene is practiced. Fingernails, it is trimmed, clean. Hair is clean, and there should be no nail polish that you should be wearing. For women, strict hand washing procedures should be followed between after handling food trays, just like how you follow the hand washing techniques in patient care. Follow the same with food: before handling food, after handling food, in between, if you're going somewhere, touching something else, okay, taking a break, wash your hands and then come back to work. Okay, the same five moments has to be followed. Hand washing is performed before, between, after visiting residents as well. When you're going and giving some to the patients have ordered something, place some order. Okay, before going, you have to wash your hands, submit the food, come back, wash your hands, and then rejoin the work. And in such a way, you have to handle all the food to avoid contact with your clothing. Even dishes are transported, avoid contact with the clothing. Do not use chewing gums, toothpicks, or nose stuff, smoking. These things are not permitted in the kitchen. Eating and drinking, even for the staff, is done outside the food preparation zones. If there is any injury or infection signs and symptoms, immediately action has to be taken. Health requirements of the food handlers are met. That is, they should not have any communicable diseases. They should not be carrier of any diseases. Health screening is also conducted before you are hiring. Orientation is received by each employee about the rules and regulations, infection control guidelines they have to follow. This orientation is given before they start their work. Then about food preparation and serving, direct use of hands to touch the food utensils or equipments should be avoided. Two-spoon method of taste testing is used, which means you scoop the food with one spoon, you place it on another spoon and taste it. Okay, that is the two-spoon method. Scoop the food with one spoon, place it on another spoon and taste it. Okay. Now, food is held at proper temperature during storage. Expired products should be immediately removed out of the kitchen pantry. And you have to always cover the food that you are serving. Open food should not be served. Leftover foods are discarded within 48 hours. Whatever you have cooked, within 48 hours, it has to be consumed. Refrigerated items are covered with labels by what time it has to be discarded, like that. Ceiling, dishwasher should be clean, sanitary. Dishes and utensils are also dried properly before they are used again. Liners are used in the garbage bins. Waste is also within 24 hours, you have to get rid of the waste. Cleaning schedule has to be followed for everything in the kitchen, and that also comes in the checklist. See, at least 3 times all the water pitchers or flask or jugs should be cleaned at least 3 times a week. All equipments in the kitchen is cleaned weekly once. Light bulbs are also cleaned weekly once. Hand washing facilities should not be used for any other purposes like washing clothes, okay, or gargling, mouthwash. These things should not be done at hand washing facilities. Water and soap and a tissue or a drying method has to be placed at the hand washing facilities. Cutting boards, meat slicers, okay, they should be cleaned on a daily basis to avoid buildup of food that could lead to infection. Refrigerators and freezers should always be clean so that they don't use expired items to not use up space. So these are the main part of your checklist. So if you have any queries in this chapter, you can ask in the chat box.